Hi, this is Dr. John Rothschild. The topic I would like to speak to you about today is clenching and grinding and gnawing. Are you clenching? Are you grinding? Are you clenching during the day? Are you grinding during the day? Or are you doing it at night? There are many reasons why people grind or clench their teeth. It is said over 60% of the population grinds or clenches their teeth. Some of the signs or symptoms that we see with people who clench or grind, whether they know it or not, is that they're wearing down the top surfaces of their teeth, they're wearing down the necks of their teeth, there is recession of the gums, there's periodontal disease, there's jaw pain, there's headaches, there is excess bone growth, such as what we call tori, which get in the way of your tongue or your cheek. Those are some of the things that we see. The other thing is there is tooth pain and sensitivity. So these are a lot of the symptoms that we see when people are clenching or grinding, whether you know it or not. There are many solutions to clenching and grinding. However, we don't know really what the root cause of clenching and grinding is. I've been in practice for over 30 years now, and we still haven't figured that out. Yes, there are many theories involved: calcium deficiency, magnesium deficiency, parasites, the bite is off, but to tell you the truth, I can't substantiate any of those. So what is our solution for some of these problems? The best thing that we can do at this point, because we can't figure out the root cause, is to have an appliance made, an appliance that covers your teeth, and I believe in a lower appliance more than an upper appliance. This will protect your teeth. Yes, it is a Band-Aid, but it sure will protect the teeth from cracking or breaking down. It sure is a lot cheaper to have a piece of plastic in your mouth than to, say, remove a tooth, put a bridge in, or even just to place a crown on top of the tooth. This is John Rothschild. Have a great day.